everybody. My name is Matt Green. I'm an associate professor of sociology here at College of DuPage. And what I wanted to talk about in this brief talk is give a little bit of a sociological take on what's been going on with the COVID-19 pandemic. So talking about social inequalities associated with COVID-19. So this is very much a core area of interest in sociology, thinking about how different aspects of society are unequal in terms of how we experience it, how we have access to various resources. And what's happened with COVID-19 is no different. Not everybody's experiencing this pandemic equally by any means. And what I wanted to do is kind of think about the health consequences of the pandemic. I mean, we could certainly talk about the financial consequences as well, but that's a whole other topic for another time perhaps. But a couple ways we could think about these social inequalities. I mean, in sociology, we think about social inequalities in various ways. I mean, along the lines of sex and gender, along the lines of age, sexual orientation, things like that. But I wanted to focus specifically on two major areas that have gotten attention in terms of inequalities with the pandemic, thinking about race and ethnicity and social class in terms of the inequalities, in terms of who has come down with COVID-19 and also who has lost their life to it. One thing that's gotten a lot of attention, and justifiably so, is the racial ethnic disparities in terms of who has been found to be afflicted with COVID-19 and also who has died from it. And the really unfortunate statistics that have come out in recent weeks is that there is, yes, this very clear racial ethnic disparity, that in particular, those places where data has been kept, they've found that Blacks and Hispanics have had higher death rates than any other racial or ethnic group. Well, specifically whites. And the thing is, we don't know that this is the case nationwide, just only because not all, I mean, we don't have national data, not all cities and states have kept racial ethnic data, but the places that have shown some of these disparities. And this graphic here from the Washington Post gives a good indicator of what I'm talking about. If you look at the bottom right-hand portion, you see someplace like the state of Connecticut, or to the left of that, the state of Florida. You don't see much of a discrepancy. So in Florida, for instance, African Americans make up 15% of the state population, but represent only 16% of COVID-19 deaths in the state. That's statistically what you'd expect. I mean, you wouldn't expect much of a disparity between a group sharing the population and their mortality rates from the coronavirus. But if you look at the upper left-hand portion of the graphic and you see the data for Milwaukee County in Wisconsin. Milwaukee is one thing that sociologists, urban sociologists in particular, know, is that it's one of the most racially segregated cities in the country in terms of African Americans being geographically segregated from whites in Milwaukee. And evidently in Milwaukee County, Blacks make up about a quarter of the county population, but unfortunately, they've constituted 73% of the deaths. Louisiana, similar story. Blacks make up 32% of the state population, but unfortunately 70% of the deaths. Then in the middle, what we see are some data kind of for our neck of the woods. The city of Chicago is one of these places that has fortunately kept data on this. And Chicago is interesting because demographically, Chicago is noteworthy because it's about essentially a third white, a third Black, a third Latino. And Blacks, according to this data, make up 32% of the city population. Once again, we see this unfortunate disparity where Blacks make up 67% of fatalities due to the coronavirus. And in the state as a whole, Blacks make up 14% of the state population, but have represented 42% of the deaths. Here's another statistic I've found that just shows kind of these inequalities I'm talking about here. This is from The Economist from April 18th. They noted that in the city of Chicago, what the data shows is that Blacks have been dying at 5 times the rate of whites. So in other words, 5 times more blacks have died of the coronavirus in Chicago than whites. Now, what so much of the media coverage has tried to do is figure out why. I mean, why is the coronavirus act in this fashion? I mean, you would think that this virus is colorblind, that irrespective of this color of your skin, irrespective of your ethnic background, it would be non-discriminatory. And so many of the media accounts do give some answers, but the thing is, sociologically, so many of the answers, sure, they do apply in a racial ethnic context, but mostly they have to do arguably with social class. And when we're talking about social class within sociology, what we're talking about are any number of factors, things like income, wealth that an individual or household has, an individual's level of education, how much or how little she or he has, the occupation that a person holds. And so many of the explanations that have been given for why, say, Blacks or Latinos are more likely to die from the coronavirus or contract the coronavirus, they're arguably social class explanations, because unfortunately in America, when you think about specifically poverty, poverty is highly correlated with race and ethnicity. And what I mean by that is that statistically speaking, African Americans and Hispanics are more likely to be poor on average than whites or Asian Americans are, for instance. And so many of these trends that we're seeing in terms of COVID-19, to sociologists who study poverty, they're probably no surprise, because one thing that researchers pointed to over time is that when you look at poor Americans, they tend to be in worse health anyways. I mean, irrespective of the fact that we're in a pandemic. And what I mean by that is research indicates that poor Americans tend to have they're more likely to deal with chronic conditions. So whether it could be like chronic pain, like back pain, but in the context of the coronavirus, they're more likely to be obese, more likely to be diabetic, more likely to be have high blood pressure. And one thing that, you know, doctors and epidemiologists have established is that if you have some of these pre-existing health conditions, you're more likely to contract and unfortunately lose your life to the coronavirus. And it's not, you know, what some people will do is say, well, the poor are in worse health and it's their own fault. They don't take good care of themselves and things like that. But in sociology, what we try to do is emphasize that when you think about inequalities in terms of social class, especially when you think about the poor, there are a lot of structural barriers that keep the poor poor, that make life more difficult for them than many maybe middle-class Americans. We don't see these structural barriers. So for example, a lot of poor Americans don't have health insurance. And even some, we're not even simply talking about poor Americans, but many Americans who lost their jobs, one of the kind of pernicious side effects of that is not simply losing the income, but also losing your health insurance coverage. So for those people who don't have health insurance, if they do get sick, they're less likely to seek medical attention. And maybe they're living in communities, whether it's a poor urban or rural community, access to medical care might be more difficult to come by. It might be more of a challenge for them to see, say, a general practitioner on a regular basis for checkups. So for multiple reasons, you know, the poor tend to be in worse health regardless, and that's has only kind of exacerbated the problems with COVID-19. One final thing to think about here in terms of explaining these sort of inequalities in COVID-19 is you think about the prescriptions that we've been given for how to protect ourselves. And one of them is social distancing, right? So when we're out in public, maintaining the 6 feet of social distance, and we have these shelter-in-place orders to make sure we don't interact with others, because with a virus likes density. A virus moves from person to person. But another thing to kind of think about here is there are social class differences in the ability to engage in social distancing and the ability to self-isolate. So one thing to kind of consider is inequalities in terms of physical space. So some people, especially poor people, they might be living in cramped living conditions. They might be sharing an apartment with multiple people. And if somebody gets sick in that apartment, it can be really difficult to kind of quarantine that person. Whereas if you're a middle upper class person and you have a larger house, somebody gets sick, you maybe stick them in a bedroom, stick them in a basement, and hopefully they don't infect others. But for poor people, the ability to kind of self-isolate like that is something that can't be taken for granted by any means. And also the ability to work from home. This is also something that's not distributed equally, as you might expect. And this is a survey I found from the Brookings Institution from the end of March, where people were asked about their ability to work from home. And you look at people, kind of the poorest Americans to many middle-class Americans, there doesn't tend to be much difference. But clearly, the more affluent somebody is, the higher their income is, the greater their ability to work from home. And so this is another thing to think about with the coronavirus, in terms of the ability to self-isolate. Those who have higher incomes, those who have more wealth, they're more likely to be able to work from home, but they're also more likely to be able to do things like get groceries delivered, do Amazon Prime or something like that. And basically not expose themselves to the virus. And so when all is said and done, yes, we have a lot of these inequalities in terms of COVID-19. Unfortunately, so many of the visible inequalities are along racial and ethnic lines. But if you step back and look at what's leading to some of these inequalities, arguably many of them have more to do with social class, and in particular, thinking about how the poor are more likely to contract the virus and unfortunately lose their life to the virus for various sociological reasons, as opposed to simply because of their race or ethnicity. Thank you for watching my presentation. Hopefully you found it informative. It's not the most pleasant of news that I'm sharing with you by any means, but so much about COVID-19, whether it's the health consequences, the financial consequences. There's unfortunately a lot of bad news to kind of consider here. But what I think the strength of sociology is giving people a better understanding of society and what our world looks like. And so hopefully what I've been able to do is kind of give you some insight in terms of how sociologists would think about COVID-19 and how we're experiencing it in America today. Thank you.